my client sustained a work injury when he was in line at the cafeteria, and there was a food spill in front of him, and it caused him to slip with the right leg extending forward and half kneeling on the left side. And he describes, can you point with your fingers where most of your pain is?
Here, and then right in here.
So he points right to the region of the sacroiliac joint on both sides. And I want to demonstrate how we not only use position, but we also use passive spring mobility testing to predict treatment. And what I found was that on the top of his pelvis on the left, on the top of the iliac crest, there is no anterior rotation mobility. On the right side, I can easily move it to a natural stop point. I can then induce a spring test and there's additional mobility. When I come underneath the sit bone and I spring up towards his ear, I can push and take up the slack to a natural stop. I can then spring it and we see additional movement. It springs forward and back. And on the left side, there's no movement. I'm not able to induce that passive spring mobility test. He also presents with a twist of his sacrum, and I can feel that the lower left quadrant is prominent, and that this little angle on the bottom called the inferior lateral angle is lower on the left. And that correlates with an ability to move on the right side in an upward direction, but inability to induce passive motion on the left side. I can push on his sacrum on the right lower quadrant, but I'm not able to push. I was able to do it on the right, but I'm not able to induce passive spring mobility on the left. And this passive mobility testing is very important because sometimes the landmarks are going to be very subtle. And so if I palpate his posterior superior iliac spine, also called PSIS, on each side, and that's this little bump on the ilium. If I palpate those and look at it, I do not see any asymmetry. When I palpate the top of the iliac bones, I do not see any asymmetry. When I come underneath the sit bone, there is no asymmetry. So the passive motion testing gives us a lot more information. People use the term alignment when a therapist uses their eyeballs to look at structure and see if it's aligned. And basically, using alignment, I would say he's perfectly aligned. But the alignment, the appearance of visual alignment of his pelvis does not tell me anything about movement. Alignment is just very basic. It's not an advanced test. And I would say that because motion in the sacroiliac joint is very, very small, at times you cannot perceive the dysfunction, the movement dysfunction, by looking at alignment. It requires the passive spring tests to determine what is not moving, and then after you treat the client, then you get to use those tests again and perceive movement through it. So the main purpose of this film is to show the value of passive spring mobility testing of the sacroiliac. And I'm going to go ahead and treat him. I have other videos where I show treatment for a left posterior ilium. I have other videos where I show treatment for a sacral torsion. So I'm not going to emphasize the treatment, but I'll go ahead and treat him and I'll show you the response to treatment. I'll show you how those mobility tests change.